Hi, my name is Ernest Thompson.
My name's Donnie Baker.
And I'm Amelia O'Driscoll.
This is my informative submission speech. So you get home from work after an exhausting day, and the first thing you want to do is take a shower, put in some clean PJs, and climb into bed. It seems pretty common in America to have a sleep debt or lack of sleep. But how about falling asleep too much? Or falling asleep in all the wrong places? Or even stopping breathing while you're sleeping? Today I'm going to inform you about 3 types of sleep disorders. I have personally experienced bouts of insomnia as a young adult and watched my father experience constant sleep apnea. These personal experiences have triggered me to want to know more about these disorders and what prompts them. First, I will discuss sleep insomnia. Second, I will discuss sleep apnea. Lastly, I will discuss narcolepsy. Let's begin speaking about narcolepsy. According to the book Sleep Disorders by Wilson and Nutt, insomnia is defined as poor sleep or lack of sleep. The American Academy of Sleep Medicine and Sleep Research Society recommends ages 18 to 60 years of age to get 7 hours of sleep every night for optimal health and well-being. Also discussed in sleep disorders, insomnia is divided into 3 subtypes. Onset insomnia, which is trouble falling asleep. Maintenance insomnia, which is trouble staying asleep. And then early morning insomnia, which is trouble waking up too early and not being able to go back to sleep afterwards. According to a Healthline article on sleep disorders, causes, diagnosis, and treatment, it can be caused by jet lag, stress, anxiety, hormones, and digestive problems. Insomnia can be problematic to your overall health, potentially causing depression, difficulty concentrating, irritability, weight gain, and problems in your work and school performance. Unfortunately, insomnia is incredibly common. Up to 50% of Americans experience insomnia at some point in their lives. The condition can be acute, which is short term, or it can be chronic, which is long term. Acute insomnia can last for 1 night up to 3 nights. And chronic insomnia can last for up to 3 nights, up to 3 months or more. Regardless of the treatment used for insomnia, it can be greatly improved or even completely taken away with professional treatment. As Miriam Stoppard notes in her Daily Mirror article, insomnia tips for a good night's sleep are exercising daily, making sure your bedroom is dark and quiet, relaxing for 1 hour before bedtime, and going to sleep and waking up at the same time each day. Also discussed in Wilson and Nutt's book on sleep disorders, in the treatment of long-term insomnia, the most important factor to be addressed is anxiety about the experiences and consequences of poor sleep. In insomnia, a cycle has been established in which insomnia itself leads to the bedroom becoming associated with poor sleep, which perpetuates the problem. As it develops, automatic or negative thoughts about the sleeping process begin to occur in the evening. CBT, which is cognitive behavioral therapy, is a structured progress that helps to identify and replace thoughts and behaviors that cause or worsen sleep problems with habits that promote healthy sleep. Unlike sleeping pills, CRT helps you overcome the underlying causes of your sleep problems. This psychological intervention treatment, together with education, is the treatment of choice for most people with primary insomnia. Now that we've spoken about insomnia, let's talk about sleep apnea. According to Eric Souni in a Sleep Foundation article, sleep apnea is a sleep disorder marked as abnormal or reduced breathing. Also discussed in Eric Souni's article, people with sleep apnea repeatedly have pauses, or reductions in breathing while sleeping. Although these lapses cause a person to awaken during sleep, which reduces their sleep quality, many remain unaware and do not awaken and are unaware of their abnormal breathing. As SUNY indicates in his article, Sleep Apnea, Symptoms and Causes, PAP therapy, or positive airway pressure treatment, is offered to almost everyone with sleep apnea. PAP therapy keeps the airways open by passive air that is pushed out of a machine into a hose and then into a mask that is worn on the face. SUNY says, however, if the symptoms of sleep apnea are severe or persist, that added treatment may be recommended to improve the breathing while resolving the underlying conditions. This may include the use of the PAP therapy devices to promote steadier breathing during sleeping, and other possible treatments include supplemental oxygen therapy and use of medications to speed up a person's breathing. Now that we've spoke about sleep apnea, let's discuss narcolepsy. According to Thomas Scrimell in the New England Journal of Medicine article, narcolepsy usually begins between the ages of 10 and 20 with a sudden onset of daytime sleepiness, although it can develop gradually. Scrimell also notes, in many people with narcolepsy, the sleep is severe, resulting in decreased focusing and having trouble staying awake at work or school and in periods of inactivity. According to Thomas Scrimell's article, narcolepsy is treated with a combination of pharmaceutical and behavioral approaches. As Scrimell indicates in his article, narcolepsy can be curbed by getting a good night's sleep and adding 15 to 20 minute nap in the afternoons and the appropriate medicine. Although many people still have lingering daytime sleepiness or inattentiveness. Doctors often try to prescribe Provigil or Nuvigil for people with narcolepsy because it is not as addictive and does not have the highs and lows of other stimulants. It is important for people with narcolepsy to have open discussions with their family and doctors about their lifestyle choices. Unfortunately, there is no cure for narcolepsy, but you can manage the symptoms so that they don't have such a big impact on your life. In conclusion, today I have told you about insomnia, sleep apnea, and narcolepsy. These are all types of sleep disorders. I have learned more about these sleep disorders, which has enlightened me for new ways to help my dad's sleep apnea and to help others who experience sleep disorders. Curbing sleep disorders is possible. We don't have to be tired every day if we have good choices and promote good sleep. 1/3 of our lives is spent sleeping. So I don't know about you all, but I plan to enjoy every minute of it. Thank you.
Good. Very good.
Good job.
Good,
Oh,
good job. Yep.